Major surgery with an in-office procedure. Only on 2 News, I met with a college student with a new lease on life and her endocrinologist using the new tech just approved by the FDA.
How have you been feeling?
I've been feeling great.
All right, good. Let me just feel your thyroid for a second.
Rachel Kilgard, a Weber State student, was feeling miserable when she went to her doctor for a blood test.
I was just feeling really tired all the time, never had energy. Even if I was getting like 8-9 hours of sleep, I had no energy throughout the day.
What she thought might be low iron was in fact low thyroid.
Dr. Falahati, he kind of like knew right away, like, yeah, this seems like more of like a toxic thyroid nodule.
Your thyroid is a small butterfly-shaped gland in the front of your neck, controlling metabolism and how your body uses energy. When it's not working, it can impact your entire body.
It was hard for me to concentrate.
Until recently, options for treatment were limited.
If it is large enough, off the surgery.
I was dead set on not doing any sort of surgery. I, like you said, didn't want any sort of scarring, and I definitely did not want to stay on supplements for the rest of my life.
When the thyroid is removed, hormone replacement is required for a lifetime.
The patients do not feel 100% after thyroid hormone replacement. So if there is any way to avoid that deficiency of thyroid hormone and the removal of the thyroid gland, that would be ideal for the patient.
Now, endocrinologists like Dr. Aliraza Falahati have new options with radio and microwave ablation.
Shrinking them substantially, and we are talking about 70 to 90 or more % in size of that nodule, and make that large nodule that is causing symptoms of difficulty swallowing, hoarseness, coughing, choking when eating food, and so on, to a negligible size where it doesn't cause any symptoms and the patient is free.
Dr. Falahati, one of the first in Utah to use both. He started 2 years ago with 1 patient a month, but is now treating 2 to 4 patients a week in office with local anesthesia.
By generating heat at the tip of this probe or needle that you would just insert into the nodule that has no nerves, it's a very painless procedure.
After just 45 minutes, the patient is headed home.
It took me maybe like a week to start feeling like really good, but I was feeling fine even the next day.
While the treatment is relatively new in the U.S., there is plenty of data from Asia and Europe on safety and efficacy.
Recurrence rate is very low. And let's say worst case scenario, you reduce the size or volume of this nodule, and then later on, there is some growth. It starts growing again. Well, it can be treated again.
The vast majority will only need 1 treatment.
Significantly reduced in size, and the rest of your thyroid sounds and looks perfectly normal.
Full nodule reduction can take up to 6 months post-procedure, but for Rachel, she felt almost instant results.
I had more energy. I wasn't as tired. The worst symptoms, I think, was anxiety. I was constantly having panic attacks out of nowhere, which was not normal for me, and that anxiety went away.
Now, the procedure can cost up to $5,000, but is already covered by 1 major Utah insurer, and it should be covered across the board in the next few months. We'll post more information on KUTV.com with specifics on if you may be a good candidate for the procedure.